What does informed consent for brexpiprazole or Rexulti look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And one of the medications that's been requested is Rexulti, otherwise known as brexpiprazole. So this is an atypical antipsychotic that has a mechanism that's similar to Abilify. So that means that it acts as a partial antagonist for both the 5-HT1A and D2 receptors. So this is a serotonin and a dopamine receptor. Because it acts as a partial agonist, this means that it can both stimulate and inhibit these receptors and ideally balance out any sort of imbalance that there is. It also acts as an antagonist at the 5-HT2A receptor, which is a different serotonin receptor. And the thought behind this is that it leads to an increase in dopamine release in certain areas of the brain, which could decrease the risk of motor side effects, things like tardive dyskinesia, dystonias, Parkinsonism. And it also acts on a number of other receptors, which may be helpful for things like PTSD, mood disorders, and cognition. Now, it is an atypical antipsychotic, and it's FDA approved for schizophrenia, but it's also FDA approved for major depressive disorder, so there does not need to be any psychosis involved, as well as agitation in the elderly due to dementia. Now, this is with the caveat that, like all atypical antipsychotics, there is a black box warning against the use of this type of medication in this population due to increased risk of mortality and stroke. As far as side effects, there's going to be things that most psychotropic medications can cause, things like headache, dizziness, stomach upset, fatigue, drowsiness, etc. And then you're going to have metabolic side effects. So that's going to be things like weight gain, increase in appetite, blood sugar issues, cholesterol issues. Like Abilify, this may be slightly less likely with the brexpiprazole than with something like olanzapine or Seroquel, but it certainly is still a risk. And then lastly is going to be the movement disorder risks. Now, like we said, it's less likely with this medication due to its mechanism, but it certainly still can occur. So this is things like tardive dyskinesia, when you have repetitive muscle movements, usually around your mouth and jaw, or a dystonia where you have a sustained uncontrolled muscle contraction, or Parkinsonism where you have slowed gait, mass facies, rigidity, and tremor. But the one that you're probably going to see the most with brexpiprazole is going to be akathisia, which is an internal sense of restlessness, which can be very intense. In addition to the black box warning for use in the elderly, other serious adverse effects that we want to counsel patients about include things like SI, neuroleptic malignant syndrome. And with this medication, there can sometimes be an increased risk of compulsive behaviors. So things like gambling or using substances, shopping, or engaging in risky sexual activity. And if considering going off of this medication, of course, I'm going to recommend doing a hyperbolic taper to decrease the risk of having a recurrence of illness or of having severe withdrawal symptoms. So after going through all this, we would talk about whether the potential benefits of this medication outweigh the risks for that individual, and we would go from there. If there's another psychotropic medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources, and I want to be able to communicate directly with you all. So if that's you, then send me a DM with your email, and I'll see you in the next time.